Well, hello, everyone. Again, this is Larry Boris from the National Association of Worksite Health Centers. Thank you very much for participating in our next session, which is managing diabetes patients. I'm pleased to have two professionals who are well-known and versed in this area. We're going to have Dr. Aggie Lund, Group Medical Director for Quad Med, and Liz Harrington, Condition Management Program Administrator for Quad Med as well. So I'll turn it over to Liz.
Thank you, Larry. Actually, I'm just going to probably pass it over to Dr. Lund here to start the presentation, but we do appreciate you having us, giving us this platform to speak about our condition management program.
Absolutely. Thanks, Larry. Thanks, Liz. So obviously this topic of diabetes in no way, shape, or form is going to be able to be covered in just a very quick 15-minute blurb, but we just want to give a very quick overview to our on-site health center, Quad Med, and the Take Control program that we have in our approach to diabetes care. So I'll just have Liz advance the slide there. So goes without saying, diabetes, definitely a condition that warrants a significant amount of focus. And it's just some very quick statistics here. Obviously, diabetes rising very quickly, 50% of adults in the U.S. has diabetes, or what we're calling prediabetes, glucose intolerance, or are at risk. The cost from that is going to be significant in all walks of life, whether it be by insurances, employers, healthcare systems, the individuals and the families themselves. And so we do know that a very small reduction in the hemoglobin A1C measurement will lead to a tremendous difference in reduction of risk factors for heart disease, peripheral vascular disease, and so on and so forth. So when it comes to delivering care for our clients, we do know that this patient population creates quite a bit of volume in terms of patient visits as well as utilization of services. Additional risks certainly come as a result of uncontrolled diabetes, again, leading to high cost claims, redirected cares, and so on and so forth. So again, this on-site clinic service that we provide can make a tremendous impact on that. We can certainly affect this, provide improvements, and then the downstream improvements from that are nearly unmeasurable, although we certainly have outcomes for that. Next slide, Liz. So just very briefly, Quad Med is a patient-centered medical home. I'm sure you're all very familiar with this concept, where we can provide collaborative, integrative, and coordinated care in all aspects of health, not just diabetes. But clearly, when it comes to diabetes and even the pre-diabetic state, having patients and associates engaged within the patient-centered medical home provides that much more comprehensive care. We're able to provide the collaboration with additional health vendor partners, allied health services, and go in a team approach or a family, so to speak, in the cares of that individual. Next slide. So I look at this as my health pyramid or my medical triangle. The vast majority of individuals are going to be in that low risk, that green is good, where we're going to focus on preventative cares, as well as screenings. And obviously within this group, whether it's through biometrics, other labs, clinic visits, we can detect those that may be at risk or actually have a diagnosis of diabetes that they weren't aware of. As the conditions and complexity increases and rises toward the top, the touch points and the intensity of cares is going to be much more collaborative. It's going to involve many more aspects of care. Again, vendor partners, collaborative teamwork, and a big effort to take that top pinnacle where we know that 20% of individuals account for 80% of healthcare costs. So to be able to drive that downward into that green base is going to be an ultimate goal. Optimization care is always a part of that, and our process of taking care of individuals are going to lead to the better outcomes. So part of that process is our Take Control Chronic Condition Management Program, of which Liz is the program administrator. So I believe next slide will go into a little bit more detail of that. I will say from a very personal experience, when I was what I call in the outside world of medicine for 20 years, it was a constant struggle and so many barriers that were put up in our efforts to help our diabetics gain control. And when we have the benefit of having a certified diabetic educator, and I know that it's a much longer, much more prestigious title these days because of the additional training it takes to achieve that, that level of expertise. I have had tremendous success in helping my diabetic patients gain that control, and then in that effort also to help address their comorbid factors. So having said all that, I'm going to have Liz delineate a little bit further about our Take Control program. Liz, I'm going
Dr.
to
Lund.
lateral that to you.
Provides patients. Thank you. I appreciate that. QuadMed provides patients with diabetes a strong and diverse diabetes team, which includes primary care providers, nurse educators, dietitians, pharmacists, etc. Our condition management program includes, as Dr. Lund stated, certified diabetes care education specialists, also known as CDCESs. CDCES or nurse educators who continually maintain an ongoing education on diabetes, cardiovascular disease, and other disease management, and advances on technologies. In our program, we avoid transportation barriers to the clinic by meeting with patients in person, via telephone, and virtual visits. And we've offered these visit types since the program launched 8 years ago. We have named our condition management program Take Control because our primary focus is to empower patients to take ownership and manage their disease, such as diabetes. Our team of primary care providers and nurse educators serve as the primary members of the client's diabetes care team and help our patients develop an individualized care plan that fits within his or her lifestyle, beliefs, and culture. We use evidence-based education to help people with all types of diabetes better manage their blood glucose, develop healthy coping skills to address the daily challenges of the disease, reduce the risks for complications, decrease costs by reducing or eliminating the need for medications and emergency room visits, and help find and act these programs. Diabetes is a condition with unique barriers for every individual. As a result, we provide and we utilize as needed to these other healthcare professionals in our healthcare plans and empower our patients and result in better healthcare outcomes. Due to our internal resources, we are able to streamline care for our patients. Some of our patients offer, or some of our clients offer incentives when their employees meet with our Take Control program, which entices them to join our Take Control program and empower themselves. These programs are called Value-Based Insurance Design Model, or VBID. VBID benefits are determined by our client. The VBID helps to connect patients with our Take Control program, and over again, we find patients report that they look forward to their next Take Control visit, and many report that they learned something new and they appreciate our assistance with streamlining them into other healthcare resources or even employer benefits available to them. And on this slide, we have an example of the minimal and criteria a client established for their VBID program. We recommend following best practice guidelines when establishing VBID criteria, which is depicted on this table. Please note that our condition management program provides additional services to patients that are not depicted on this table. Now, I'd like to transition back to Dr. Lund to review some of our condition management Take Control program outcomes over the last 8 years.
So obviously, when I talked about going through the process of diabetic care, I mean, what's really going to matter is that makes a difference in that control and in the treatment of the diabetic. So we do have a white paper on this. And with our program, an 8-year look back with one of our large clients with whom we have a very close relationship, we have found that 87% of diabetics have gained control of their condition. And it makes such an incredible, huge amount of difference knowing that with this particular client, over an 8-year period, we demonstrated a 2% increase in diabetic related spend compared to 38% increase in spend for those who were not engaged in our program. So that's a very, very quick uh, overview of that. Again, that white paper is available. That is, if should you be interested in anything a little bit more in depth than that. But you know, knowing that this tremendous improvement in just the outcome spend makes that much of a difference for our clients, but obviously in the care of our patients, when 87% of those are in control compared to 80% of community-based individuals using what I call outside medicine or outside insurance. The impact of this clearly downstream is going to be tremendous. And we have found that our patients are much more engaged. They are involved in their care. They are compliant with their medications because we can follow up with them on this on multiple levels, both from a provider and the nursing staff, as well as from our take control staff. So they truly feel that they're part of a team in the cares that they require. And again, remembering that when we're addressing diabetes or all the other additional comorbid factors that we are also addressing, such as heart disease, obesity, kidney disease, vascular disease, and even smoking cessation obviously has a tremendous impact on these additional risk factors. So formally, I believe this is all we have for you in this very brief amount of time. Larry, how are we doing for additional time if anybody might have some quick questions for us?
Sure. So we've got about 3 minutes to go. So if anybody has any questions about this, please feel free to ask here. We will have a full session tomorrow on managing diabetes in a case sample of one employer at the Metro Nashville School District. So if you're interested in this topic, please be sure to get into that. But at this point, if you have a question, please put it in the chat room, or because we've got about 44 people now, so it's kind of hard to go around the table. So please let me know, have a chat or something. Let me ask you specifically, Liz, what you talked about incentives. Could you describe the incentive programs that many employers, or what are the most successful ones?
Sure. What we typically see for incentives would either be like a prescription discount or even free prescriptions and supplies. I've also seen HSA dollars accredited from the company to the patient's account. So those are just two examples that some provider or some employers have offered to their staff.
Also, a question for you. There have been some digital vendors that offer screening programs for diabetics. Do you link those to what you do as well?
Yes, we typically do link with our services with that. We actually do have a wellness department as well. So with many of our clients, we actually are performing those biometric screenings. So we typically have access to that data and working with each client move forward on that. But we definitely do recommend working off of those biometrics.
Great, great. Do you include pharmacists in your programs as well?
Formally, I can take this, Liz. Formally, not as part of the program, but we do engage our pharmacists for medical management recommendations. So I guess informally we do because we consider them part of the team. Formally, they're not part of Take Control. Would that be an accurate statement, Liz?
It would, except for one of our clients. We do have one in Michigan who is a pharmacist, CDCES.
That's right. Right. We got 2 for 1 with that one.
Correct.
For sure.
Yeah.
Yes.
Right.
But obviously, these patients who are on multiple medications, any advice and input from a pharmacist is critical.
Understood. Well, thank you both, Liz and Dr. Lund, for your presentation. At this point, I would ask people, if you have any questions for Liz or Dr. Lund or for QuadMed, please go to their exhibit booth in the exhibit hall, and you can chat with some people there, and they can give you some more information about QuadMed as well as its programs. We are now going to ask you to leave this particular session, and we have a new next session is coming up on what employers value from their worksite clinic partners. So click out of this one and click into that one, and we'll get started shortly. Thank you very much.